52-year-old American man discovered that his worsening migraines weren't just headaches. They were caused by parasitic tapeworm larvae lodged in his brain. The likely source of infection? His habit of eating undercooked bacon. The man sought medical help after his usual migraines worsened, becoming more frequent and unresponsive to medication. Hospital tests, including CT scans and antibody analysis, confirmed the parasitic infection. The patient hadn't traveled to high-risk areas, leaving his consumption of undercooked bacon as the most likely cause of the infection. While the disease is more prevalent in developing countries with poor sanitation, this case demonstrates that the risk exists even in developed nations. The condition, typically resulting from ingesting food or water contaminated with tapeworm cysts, led to a successful treatment regime for the man over 14 days. Researchers speculated that his neurocysticercosis could have stemmed from an auto-infection cycle initiated by his own eating habits and poor hand hygiene after contracting an intestinal tapeworm. Eating undercooked meat poses significant health risks due to the potential presence of harmful bacteria and parasites, such as Salmonella, E. coli, and tapeworms. These organisms can survive in meat that has not been cooked to the appropriate internal temperature, leading to foodborne illnesses characterized by symptoms ranging from mild gastrointestinal distress to severe dehydration and, in extreme cases, death. What happens when you eat crocodile meat? A woman from Congo discovered a parasite living beneath the outer layer of her eye for 2 years. The parasite, identified as Armillaphor grandis, is a species commonly found in African snakes. Doctors suspect the woman likely contracted the parasite from eating undercooked crocodile meat, as crocodiles can sometimes be infected by the same parasite. This rare infection marks a potential first in medical literature, as no previous cases linked crocodile consumption to this infection. This rare eye infection is known as ocular pentastomiasis, and it's caused by pentastomid parasites. They primarily target snakes as their final hosts, with eggs passing into the environment before being ingested by small mammals. Completing the cycle, a snake then eats the infected mammal. Humans become accidental hosts through contaminated food, water, or close snake contact. The woman in this case denied snake exposure, but admitted to regularly eating crocodile meat, which can also harbor pentastomids. While internal organ infections are the most common outcome for humans, they typically go unnoticed. However, eye infections, though rare, allow for easier detection due to symptoms like redness, pain, and vision impairment. Treatment necessitates surgical parasite removal. Killing them with drugs can trigger a dangerous immune reaction. Diagnosis is visual, and prevention relies on strict hygiene around reptiles and avoiding undercooked reptile meat. Doctors recommend increased awareness of this rare, potentially severe disease, especially in areas where it naturally occurs. What happens when you eat sea turtle meat? In a tragic incident on Pemba Island, part of Tanzania's Zanzibar archipelago, 8 children and 1 adult have died, with at least 78 others hospitalized after consuming sea turtle meat. The consumption of sea turtle meat, considered a delicacy in this region, has led to these fatalities and illnesses due to chelonotoxism, a rare but potentially fatal form of food poisoning for which there is currently no cure or identified treatment. The exact species of sea turtle and the dates of consumption and resulting hospitalizations or deaths were not specified, but the incident shows the dangers of ingesting sea turtle meat, which can carry toxins harmful to humans. These toxins can lead to a range of symptoms from mild nausea and vomiting to severe neurological, hepatic, and renal toxicity, and in extreme cases, death. This is not the first time such an incident has occurred in the area, with previous reports of deaths and hospitalizations due to chelonotoxism, prompting local authorities to deploy disaster management teams to warn the population against the consumption of sea turtle meat. Sea turtles can accumulate toxins in their bodies from the environment, and these toxins can build up to dangerous levels for humans who consume the meat. On top of that, sea turtles may carry bacteria and parasites that can cause other diseases in humans. Apart from food poisoning, most sea turtle species are critically endangered. Eating them directly contributes to the decline of their populations and puts them at greater risk of extinction.